Guys, the lecture today is about pneumococci. These pathogens are type of streptococci. However, they are slightly different from the streptococci in following ways. One, they are capsular. Second, they are not exactly spherical. They are slightly conical or lancet shaped. And thirdly, instead of living in long chains, they live in pairs. That is why these are also called diplococci. So let's look at these pathogens, very important pathogens, and one of the leading causes of pneumonia, especially community-acquired pneumonia in United States. And of course, you know that pneumonia causes a lot of deaths as well, so this is really an important pathogen to know about and to know how to treat it. This particular lecture is going to present the pneumococci as a memory aid, and the help that you would get with this is that you can, in your examination, this can help recall the facts about pneumococcus very quickly, and similarly when you're practicing it will be very easy to recall or identify the various signs and tests and then quickly connect the dots that you are handling a patient with the pneumococcal infection. So with that, let's start. First of all, let's put the pathogen out here and see how it looks. So look at this pathogen. There are two pneumococci here. One is this one and the other one is this one. So again, if you see, these are elongated pneumococci, they are not spherical. Secondly, if you see, this is my version of the pili, so all those thread-like things that are coming out are pili. Why pili are important? Pili are one of the virulent factors for pneumococcus. These pili allow the pneumococcus to adhere to epithelial surfaces, and that is how they stick out there and cause infections. Interesting thing is that these pathogens are capsular, and the pili, if you see, so here is the capsule, and if you see that the pili actually come out of the capsule and allow the pathogen to continue adhering to the outer surfaces. So one more thing to remember is that these are capsular pathogens. Now, capsular pathogens have their own particular properties, but before that I want to point out the color here that you see, the purplish color, is because these guys are gram positive. So of course these are gram positive. These are also catalase negative, and that is why in my teaching I make them as snakes, because snakes bite cats and they kill the cats, so no cat for this snake-like pathogen, and that is why no catalase here. So gram positive, catalase negative, half pili, is capsular, lives in diplococcal state or lives in pairs, is not exactly spherical. So now let's talk about the capsule a little bit. The capsule is the most important virulent factor. Pili are virulent factors as well. However, capsule is the most important virulent factor. What capsule does is that it reduces the activation of C3b. And if you know that C3b activation is important for phagocytosis. So the end result is that the capsule is antiphagocytic. That means our macrophages cannot easily clear these capsular pathogens. And by the way, this is the same situation for other pathogens as well. It is not just for this. So how do these pathogens get cleared? Most of the times when these pathogens, while circulating in the blood, when they reach the spleen has reticuloendothelial system where these pathogens, which are capsular, these are big enough, they get caught in those sinuses, and then the macrophages present there clear it out. This also means, and this is a test question for USMLE, plus this is a very important practice concept, that if you are handling a patient with recurrent pneumonias or respiratory infections, you should start suspecting that there may be something going on with the splenic system. For example, patients with the sickle cell disease, they over time develop scarring and injury of the spleen because of the red blood cells destroying there, and the result is slowly spleen becomes non-functional, destroyed. So patients with sickle cell disease or asplenic patients have recurrent respiratory infections because these patients are unable to clear pneumococcal and other capsular pathogens with ease from their system. So remember this about the capsule. The other one thing that is really important about the capsule is vaccination. So capsule, this was actually the first pathogen whose capsule was used to create vaccines. So what happened was that the polysaccharides from the capsule, so capsular polysaccharides were used as antigens, and antibodies formation was triggered by using those antigens in the vaccines. So there are two types of vaccines, you must have heard about it. 23-valent, which is for adults because children fail to mount a response to these, and then there used to be 7-valent for children. Nowadays these have been replaced with 13-valent capsular polysaccharide conjugated vaccine for children and non-conjugated for the adult. So capsule has a lots of important properties, and there are many questions. So right now the question about the capsule, the question about catalase negative, question about antiphagocytic, questions about vaccination, and the difference of vaccination between adult and the children is very important. For example, children is conjugated while the adult is non-conjugated. Then adult is 23-valent and children are 7 or 13-valent vaccines. So that is about the capsule. So now if we continue looking at it, look at this splatter that just appeared. This is actually India ink here. This is India ink. So this would help you remember that this is India ink test is important, and that also means Kollang test. So India ink or Kollang test. I hope that is the right pronunciation. Kollang test. And please remember again, this test is going to be positive for all capsular pathogens. So what happens is you put the pathogen on India ink. India ink appears black under the microscope. However, the capsule of the pathogen absorbs the fluids and swells up. When it swells up, it appears as clear areas under the microscope. So in that dark India ink you see clear areas, and these are the pathogens. That is what is called Kollang test is positive. So clear zones around the pathogen, or for the capsule of the pathogen for the India ink, so that test is positive. So Gram is positive, Gram test is positive, India ink or Kollang test is positive. We'll see some more tests shortly which are going to be positive. So why not we just look at them right now. So look at this. See this jaw over here, and the instead of the teeth, these are small bottles, green bottles with the monsters on them. So this is to help you remember that. Remember this jaw from chin. So this pathogen, see he's leaning away from this chin and the bottle. So this is optochin sensitive pathogen. So what that means is that in the presence of optochin, this pathogen would die. So optochin is an antibiotic for this. So it is optochin sensitive, so it opts to stay away from the chin. So that is why, and that's why it lives in throat and it goes to the lungs, but it doesn't come anywhere near the mouth or the chin area. So it's the optochin sensitive. That is what can help you remember that. Then look at these teeth. These teeth are actually made up of these bile bottles. And if you see, these bottles are acting as little monsters that are also scaring this pathogen. So the bile, it does not grow. No growth in bile. That is also an important test. No growth in bile. So now how many tests do we have? We have gram positive, we have cholangiosis positive because of the capsule, it is optogen sensitive, so that is the antibiotic, and then the no growth in bile. These are all tests. Now moving on, let's talk about, look at this, this is actually a pathogen which is going to become a character that you would see. So you're seeing an arm here and it is holding a hammer in its hand, and that hammer, if you see, this looks like an immunoglobulin, and this also looks like an immunoglobulin, and this red area here is connecting these two immunoglobulins. So this is the IgA protease enzyme that this pathogen has. So this is another virulent factor. It uses IgA protease to break down the IgAs. And where are the IgAs present? They're present on the epithelial surfaces, right? IgA dimers connected with the J chain are protecting the surfaces, and pneumococci have IgA protease that break those IgA barriers and help the pathogen cause infection. So very important, please remember that. Then is, look at this, the other hand has this disc in its hand, and this disc is called the pneumolysine. What that is these are like membrane attack complexes. This pneumolysine is like membrane attack complex. If you've read the complement system, if not, please look at our videos for immunology on the YouTube and other places. Now, membrane attack complexes, these are clusters of the proteins that when put on the surface of a cell, so let's say if this is a cell, and if you, this cell here, if you put this membrane attack complex or this protein on it, it's going to create a hole in the cell, and the cell content is going to leak out. And when the cell content is going to leak out, of course, that means cell is going to die, right? This is the same thing that this pathogen, the pneumonia or pneumococcus, does. It has these pneumolysines present. This is the same protein it uses to also cause hemolysis. Remember, it is an alpha hemolytic pathogen. That is another identification sign, and that is done through this pneumolysine. This pneumolysine is also important to cause the damage to other cells. Most importantly, when this causes the meningitis, the brain cells are destroyed by the pneumolysine as well. So what happens is that this disc-like structure is pasted by this pathogen onto the cell surface, and the cell gets a hole in it and it dies. The interesting thing is that these discs, imagine if these were inside this pathogen, and the pathogen has, the pneumococcus has what we call autolysines. That is another virulent factor. Autolysine, as the name says, autolysine, it causes autolysis. It kills the pathogen itself. So when the pathogen dies, it opens up, and from inside the pathogen, the pneumolysines come out and they spill around onto the tissue cells, and these cells start dying. So please remember this as well. This is a very important virulence factor, pneumolysine. Moving on, here if you see this snake head here. Why snake head? I think now at least all of my students know it very well. I call streptococci and pneumococci snakes because they are catalase negative, and to remember that, I call them snakes, and what that means is that these snakes bite the cats, and so that is why they are catalase negative. So this is the snake head over here. Moving on, so that should help you remember that this is a catalase negative. Moving on from the identification and the virulent factors to now diseases. So first thing to remember, look at this sickle that I just put on the capsule of this pathogen. And one thing about the capsule should actually be around both of these pathogens, both of these spherical or lancet-like pathogens. I just made it around one just to show it. So here is a sickle, and this should help you remember that patients with sickle cell disease are exposed to recurrent infections with the capsular pathogens, and pneumococcus being one of them. Finally, look at this mop. So we have to call it mops. And you can remember it with this, that this little baby snake uses the mops to clear the area underneath from India ink. So what that means is mops is the little help mnemonic to help remember what diseases this thing causes. So it causes meningitis, M for meningitis. I'm going to write it down here. Meningitis. O for otitis media, middle ear infection, especially in the children. Then P for pneumonia, that is how its name, and pneumonia is the largest thing that it does, largest infection, most common infection, and especially community acquired infection is pneumonia. And finally sinusitis, S for sinusitis, also S for sepsis. When this pathogen is present in the blood, what it does is that its capsule causes increased TNF production, tumor necrosis factor production. That factor then ensues or triggers septic shock. So that is another way, another virulence factor that it does. So please remember infections caused by this thing with mops. Now for the treatment, I will create a separate little visual clue to help with the treatment, but remember this at this time, penicillin is basic traditional treatment. If penicillin doesn't work, then you can use third generation cephalosporins, and if they don't work, you can always use vancomycin, which so far has been successful with this. So imagine Celine Dion, pen like Celine Dion, that is penicillin. She is driving a van with the 3 safe in it, so 3 safes in it, and that is the third generation cephalosporin sitting in a van which is driven by Celine Dion, and that is a penicillin. So penicillin, third generation cephalosporins, and vancomycin. So that is what we got about the pneumococcus. Hopefully this is a very high yield topic, and this should give you in USMLE and others multiple questions that you can attempt correctly with this information. Thank you.